Hey everyone, let's jump right into this explainer. Today, we're untacking a massive, hidden medical mystery that's literally affecting millions of people worldwide. We're going to break down a cluster of conditions that absolutely loves to fly under the radar. So stick with me as we untangle the science, the real-world risks, and most importantly, the actionable steps you can start taking right now to protect yourself.
Imagine this for a second. What if your body is building up a powerful risk for chronic disease right this very minute, and you don't even feel it? We usually think of being sick as something obvious, right? Like a bad cough, a fever, or sharp pain. But the wild reality we're diving into today is that one of the absolute biggest health threats out there operates in total silence. It's quietly setting the stage for major health events like diabetes, heart disease, and stroke, literal years before you'd ever notice a single symptom.
All right, Section 1, the silent health threat, operating in the background unnoticed.
You know, this right here is exactly why we call it a silent condition. On the outside, you might feel perfectly fine. You've got energy, no obvious warning signs, you just feel healthy. But beneath the surface, things can be a completely different story. Despite feeling great, you could actually be walking around with elevated blood pressure, abnormal cholesterol, or insulin resistance, and all of that is causing quiet, background damage to your blood vessels, your heart, and your kidneys. The scary part is that the inside of your body just isn't matching how you feel on the outside.
And since there aren't any loud alarms going off in your body, catching this early is incredibly tricky. Usually discovery happens in one of two ways. Either you stumble upon it during a routine checkup, or worse, you don't find out until some severe complications actually hit. That's why routine screening is absolutely your best friend here. I mean, waiting for symptoms to appear before checking your metabolic health is kind of like waiting for the roof to catch fire before you finally test your smoke detector.
Moving right along to Section 2, Unmasking Metabolic Syndrome. Identifying the 5 clues.
Okay, I want you to lock this number in your head. 3. Here's the thing about metabolic syndrome. It's not just one single disease. It's actually a cluster of metabolic abnormalities that like to hang out together. And the key takeaway here is that you don't need every single warning sign to be in the danger zone. The magic number for a diagnosis is just 3. If you have 3 or more of the specific conditions we're about to look at, you're generally diagnosed with metabolic syndrome.
So what exactly are these 5 clues? We're looking at increased waist circumference, which is often called abdominal obesity. Then you've got elevated blood pressure, high fasting blood glucose, high triglycerides, and low HDL cholesterol. That's the good cholesterol, by the way. Now sure, each of these is bad news on its own, but when you combine them, it's a whole different ballgame. They compound on each other, creating a massively amplified risk for some really serious complications.
Okay, Section 3. The insulin resistance domino, uncovering the core mechanism.
To make sense of how those 5 seemingly random conditions actually connect, we literally have to look at the absolute linchpin of this whole thing, insulin resistance. This is basically a state where your body's cells just stop listening to insulin. They become stubborn. So what does your pancreas do? It goes into overdrive. It starts pumping out more and more insulin just to get the exact same job done. And that right there is ground zero for a very dangerous chain reaction.
It's a literal, actually, scratch that, it's more like a runaway train. But let's stick with the domino effect here. Step 1, your cells resist the insulin. Step 2, the pancreas overproduces insulin to try and force the issue. And step 3, all that overcompensation triggers a cascade of chaos. Your blood sugar creeps up, fat storage around your midsection goes into high gear, triglycerides spike, and your good cholesterol drops. Suddenly, boom, you've got a perfect storm of metabolic dysfunction.
And here's where it gets really tricky. This isn't just a straight line from A to B, it's a loop. You get this chronic low-grade inflammation and these hormonal imbalances that just keep feeding back into the disease. If we don't jump in and interrupt those dominoes, the cycle locks in. And the longer it goes untreated, the harder it is to reverse, which just paves a wide-open road for severe long-term health crises.
Which brings us to Section 4, risks and hidden consequences, beyond the laboratory values.
So what actually happens if this vicious cycle just runs wild? Well, metabolic syndrome is way more than just a few red flags on your lab paperwork. If you leave it unmanaged, your odds of developing life-altering conditions go through the roof. We're talking about a major systemic breakdown here. Your cardiovascular system gets hit hard. Think coronary artery disease, heart attacks, and strokes. Meanwhile, your metabolic and filtration systems become super vulnerable to type 2 diabetes, fatty liver disease, and chronic kidney disease. This is exactly why getting checked out early by a doctor is so crucial. You want to catch this before it causes permanent organ damage.
Now, you might be wondering, what actually pushes someone into this risk zone in the first place? Well, while getting older and your family history definitely play a part, the primary culprits are actually your lifestyle choices. Things like physical inactivity, eating diets packed with processed foods and added sugars, carrying excess weight, smoking, and dealing with chronic stress or terrible sleep. But hey, here's the most empowering part of our explainer today. Almost all of those triggers, they are entirely under your control.
And that perfectly sets up Section 5, reversing the condition, your blueprint for action.
All right, here is the absolute best news. Unlike a lot of chronic diseases out there, metabolic syndrome is highly reversible, especially if you catch it early. Let's walk through this 5-step blueprint to disarm it. Step 1, level up your nutrition. Ditch the ultra-processed stuff and lean into fruits, veggies, whole grains, and healthy fats. Step 2, get moving and stay physically active. Step 3, focus on sustainable, healthy weight loss. Step 4, and people always forget this one, manage your stress and sleep, because mental health is metabolic health. And finally, step 5, always follow medical advice, because your doc might need to give you medications while your new lifestyle habits kick in.
I know, that might sound like a massive, overwhelming life overhaul. But honestly, you don't need overnight miracles here. Experts say just 150 minutes of moderate aerobic activity a week does wonders. That's literally just a brisk walk for about 20 minutes a day. Combine that with losing just 5 to 10% of your body weight, and you can significantly improve several components of metabolic syndrome. It's those modest, sustainable tweaks that yield the most incredible, measurable benefits.
Modern medicine is really pushing us to look at this holistically. This whole body perspective is super important because your major organs, your heart, your liver, the pancreas, kidneys, blood vessels, and yep, even your brain, they aren't just sitting there isolated. They're deeply interconnected by your metabolism. So playing whack-a-mole with just one risk factor doesn't work. But on the flip side, when you improve your overall metabolic health, you are literally actively protecting almost every major organ system in your body, all at the exact same time.
I want to wrap up with this really profound thought from our source material. Metabolic syndrome reminds us that chronic diseases rarely develop overnight. They creep up on us. They evolve gradually through hidden changes that can go unnoticed for years. But hey, awareness creates opportunity. Every single day, your habits are either slowly building disease or they're actively constructing a long, vibrant, healthy life. So, knowing that this condition is highly preventable and totally reversible, what small change are you going to make today?